Sorry, you'll hear that. MediMatch is a two-sided talent platform for healthcare professionals and employers. It gives healthcare professionals the opportunity to match with possible job opportunities. So far, we've got thousands of healthcare professionals as part of our community. And there are dozens and dozens of hospitals and healthcare providers hiring on our platform. It's totally free, and we run a number of events, whether it be in person or virtual events throughout the year. So this is one of our virtual events, and we have a YouTube channel which all of our videos that we run will be put on. So this will appear on YouTube in the next week or so. One of our partners is a HCA Healthcare. HCA Healthcare are a global brand, but we do partner with the UK provider. They have a number of hospitals across the UK, and we're joined today by Megan Pritchard, who is part of the HCA Healthcare group. And today we're going to be talking about building a successful career in oncology. So I know a lot of people have been are tuning in from around the world. So if you do have any questions, feel free to write those questions in the chat box on the bottom right, and we will ask those questions at the end. It can be related to working in the UK, working in oncology, talking about career opportunities, talking about going up the career ladder. Feel free to ask any questions. No question is a stupid question. So without further ado, I would like to hand over to Megan to start the presentation.
Thanks, Philip, and thanks everyone for joining. So I'm Megan Pritchard. I'm a sister at Leaders in Oncology Care, which is part of HCA Healthcare UK. So Leaders in Oncology Care, or the LOC as it's known, is a chemotherapy outpatient service. We look after purely adults across both hematology and oncology, kind of solid tumor disease. Anywhere from the trajectory of kind of diagnosis right through very advanced cancers and kind of everything in between. And yeah, it's in private healthcare. And then kind of the other side of my role, as well as looking after these patients, is managing. So I manage a team of 18 people, and that's nurses working on the treatment suite, that's healthcare assistants. And then I also manage our 24-hour triage service that patients can access. So if they don't feel well when they're receiving these chemotherapy, immunotherapy type drugs, they can call up and we provide advice. So I also manage that service as well. So this presentation is just kind of talk through a little bit about my career and obviously how I sort of got into oncology and the steps I've taken to get to the role I'm in at the moment, and kind of some advice for people potentially wanting to work in oncology as well. So I graduated university in 2014. So I went to Sheffield Hallam University in the north of England, where I studied adult nursing. And throughout that kind of 3 years of university, I worked across multiple different specialties, acute medicine, surgery, elderly medicine. Didn't really have any exposure to oncology. I did some extra shifts as a healthcare assistant where I worked in oncology units. And I do remember kind of thinking at the time, it was a highly specialized area that I probably would never be able to achieve because of the kind of knowledge and skills of those nurses that were working on that ward. So when I left university, I wasn't really sure what I wanted to do. And I'd really enjoyed my district nursing placement. And I thought maybe that was something that I would potentially like to do. So I moved to London at the end of 2014, actually, and worked for Whittington Health NHS Trust in the north of London as a district nurse. So that role was kind of looking after patients with any problems at home where they were housebound. So it could be administering medications, it could be providing wound care, it could have been doing some pressure relieving things, looking after people at the end of life. It was really a really broad role. And during that time, I got promoted and I got my band 6. And I actually managed a team for the first time, kind of a year out of qualifying, which was a massive learning curve for me because at the age of sort of 23. I'd never managed anyone before, so I learned a lot in that role. I think for someone coming straight out of university, it was a great opportunity because it really taught me how to be autonomous. You were by yourself seeing these patients at home, so you weren't, I'd gone from being 100% supervised at university to working completely independently. And I think that stood me in really good stead for feeling quite self-assured and confident in my nursing skills later down in my career. The other thing it taught me was really sharp assessment skills for patients. So because, at home you were assessing these patients by yourself, you had to be able to communicate that assessment really well if you were linking in with a GP or someone more senior, as well as having kind of developing that nursing intuition whereby if a patient was unwell, but it wasn't necessarily showing in their vital signs, for example, that they were unwell, but you just kind of know that they're unwell, that kind of key instinct really developed in me. And that's, again, stood me in really good positioning later on down my cancer care career, because cancer is an incredibly complex disease and actually it's not always obvious what's wrong with the patient. So again, having that kind of intuition being developed has been really helpful. The other thing I really liked was I got to know patients really well. So obviously, going into a patient's home and looking after them at home, it was a really brilliant opportunity to get to see patients in their own space, and actually having someone invite you into the home to provide care is quite a privilege. So I really enjoyed that, and you got to know the patients so well over the 2 years. You'd see the same people over and over again, and I love being able to kind of build relationships with my patients over quite a long period, which was a great opportunity for me. I did find that the reason I wanted to look at doing something more specific was because in district nursing, you kind of could do a little bit of everything, but you weren't really a master of one thing. So I wanted to develop my skills in a particular area. I hadn't, like I said, had much exposure to oncology. In district nursing. The exposure to cancer care that I got was often towards the more palliative and end of life care, which I actually really enjoyed providing. I found it just an incredibly rewarding skill set to have, being able to look after someone in their last few days of life, being able to make a really big impact in terms of changing pain medication, managing symptoms, linking in with the palliative care team. And then we would also see patients who were on chemotherapy as well. So we might administer supportive medications at home to them. So I kind of started to think this was maybe an area that I would like to work in. And I started kind of looking for oncology jobs around London. Like I came across HCA and it seemed like a good company, a good opportunity. I went for interview, I did a walk around ahead of my interview, got to see the oncology inpatient ward, just really liked the atmosphere of it, really liked the value of the company. So in 2016, I joined HCA as a staff nurse in oncology. So that was at the Harley Street Clinic, and worked in inpatients there. And again, was quite a big learning curve for me. It was very different to anything that I'd done before. I'd been out of working in inpatient care for 2 years at that point, so it was quite a transition. It also meant I had to step down. So where I got my band 6, I went back down to a band 5, and kind of wasn't at the kind of higher up the pecking order anymore. So it was an adjustment in terms of learning a lot from other people as opposed to being the person that people always went to with problems. But it was great. The team really looked after me. I felt like I found the transition difficult at times, but there was so much to learn in terms of looking after cancer patients. And I think it really opened my eyes as to how sort of chronic a disease cancer is, as opposed to what you often see on the TV as it's all doom and gloom. And it's actually a fantastic opportunity, and there's such a difference that can be made working in cancer care. In 2017, so about 8-9 months after I joined the Harley Street Clinic, I got promoted to senior staff nurse, and then shortly after that in 2018 got promoted to sister. So by that time the service had actually moved to another one of HCA's facilities, so I joined there as a sister, and provided kind of oncology care to patients, again in an inpatient setting. It was around that sort of time that I was finding that I didn't love the 24-hour shift pattern, which I think a lot of people don't in nursing. So that was one of the reasons I looked to move. But actually the main reason was I really missed providing care to patients over several kind of years, like I had in my district nursing role. So outpatient, I mean, with inpatients, you potentially would get patients there for a long time. They might be there for 6 weeks at a time potentially, but sometimes we would see a patient for a few days, discharge, and then not see them again for several months. And I wanted to be able to see patients kind of, more consistently, more routinely, week in, week out. I think I was also getting a little bit fatigued with the palliative care side of things. So again, because people are in hospital if they're not well, and it was, you know, it was kind of, you give a lot of yourself in cancer care, and I think it was a great opportunity to be able to move to an area where, you know, patients were doing quite well with cancer. And I think until I moved to outpatients, I kind of had forgotten that people could go to work while they were having chemotherapy, or, you know, people had families, and you know, cancer didn't take over their whole lives like it sort of seemed in inpatients. So yeah, so I moved to the LOC in 2019 as a sister, and I've been there since then. So I'm still there at the moment in 2023, and I absolutely love it. I love the type of care we provide to patients. So like I said, it's at any point of their kind of disease trajectory, right from diagnosis, very early stage cancers, right through to metastatic cancers. We see a lot of patients that have maybe had treatment in the NHS and then they've moved over to private care for a second opinion, maybe when they've run out of treatment options in the NHS. We see a lot of an international patient group as well, so patients from overseas, particularly kind of the UAE, which is great. And it's great from kind of a cultural aspect to understand different cultures and managing that, as well as a huge number of patients from kind of within the UK as well. So it's been a really good learning opportunity, and particularly because we get to use a lot of different therapies as well. So again, it's really stretched my knowledge of cancer care and what you can do as a nurse in this field. We see a lot of drugs that maybe aren't available. We're sort of a step after trials sometimes. So before they become for use in the NHS, we get to use them first often, which is great. Again, in the 4 years since I've been there, the trajectory of cancer has changed massively. Triple negative breast cancer, for example, the amount of treatment options that are now available for those patients has really, really changed. We use a lot more immunotherapies, a lot more targeted therapies, and less of those traditional chemotherapies that make patients really unwell. So it's been really exciting to be on the forefront of that kind of side of it as well. So in terms of my education, so I did a BA in adult nursing from Sheffield, which I got first class honours in, and alongside that I did a leadership award, which was kind of developing leadership skills, which again was something I hadn't done before, and I think probably contributed to why I managed to get a band 6 quite quickly after qualifying. I also did a kind of understanding health improvement module alongside my degree. So again, kind of, it was a lot to do with health promotion and kind of ensuring good health for the population as well. So it was great and really helped my district nursing. And actually now we have a lot of conversations with patients about improving their health while undergoing cancer treatment. And there's a lot of myth busting around that as well. So that was really great. When I moved into my first job, I undertook a mentorship course at Middlesex University, so I could mentor students, sign off their skills, sign off their placements. And I think mentoring students, I learned so much from, particularly in those first 2 years. It wasn't long since being out of university, so I knew that, you know, I still remembered what it was like to be a student myself. And actually, I think in terms of kind of understanding what you've learned and how far you've come, teaching that to someone else really shows you actually I sort of do know what I'm talking about. So I really enjoyed doing that course and love having those skills now. When I moved to inpatients, I undertook the chemotherapy principles and practice module at King's College London. So this was to enable me to give chemotherapy to patients. So there was some kind of workplace practice with that. I had to do an essay, I had to get a lot of the hours signed off to say that I was safe to give chemotherapy. And although I guess that's kind of the skill sign off, the learning is just taking place all the time. Like I said, we use so many different therapies. You know, I'm kind of constantly using what I learned in that course and applying it to different areas, particularly around managing side effects. That's really sort of developed my knowledge in terms of how to do that and apply that to other areas and other drugs that are more commonly used now. And then within HCA, I did a level 2 communication skills course. So for anyone who potentially wants to look at a CNS career in future, a clinical nurse specialist career, a really vital course to have. It's sort of the next step up from kind of basic communication skills, and focuses really on dealing with difficult conversations, breaking bad news, complaints management, dealing with angry patients. Obviously with cancer, there's a lot of anger that comes with diagnosis. So that was a great course. It was led by a psychiatrist, and again taught me a lot about how to manage patients, and it's really stood me actually in really good stead in management as well, because it's meant that I can really communicate effectively with those people that I manage and get the best out of them. And then at the moment, I'm currently undertaking an executive master's in leadership with Bayes Business School at City University. So this is half master's, half apprenticeship. The course has been funded by HCA, which has been an absolutely kind of excellent opportunity for me. And it's kind of leadership skills for business. So looking at finance, economics, marketing, all kind of skills, as well as personal development, change management, stuff that I do a bit more regularly. So it's given me a really great exposure to all sorts of different things. And alongside that course, I'm working with other colleagues within HCA, people within NHS trusts, and then also people who don't work in healthcare. So it's been a great opportunity to kind of learn different approaches to scenarios from those colleagues that don't work in my industry, because actually I think healthcare, we often have quite a set way of approaching things, and it's really challenged my kind of personal development and how I potentially approach situations. So this is kind of, I'm due to complete in the summer of this year, and you know, hopefully will take me on the next step of my journey in my career and have that leadership base. So yeah, it's been great. This was kind of some potentially more education that I did. So this top left is a Nursing Times article that I wrote. I did this when I was a student. Wrote an article about mentorship and, you know, how important that student-mentor relationship is. And again, something that I learned even more on the other side of kind of the mentorship-mentee relationship, where I was doing it myself. In the middle and on the right, I wrote an article that was published in the Nursing Standard about palliative care. So again, something that I really struggled with when I was a student nurse, and I think something that a lot of people struggle with. I was quite young when I had my first exposure to palliative care, and actually being able to reflect on that, have excellent mentorship, was really helpful for me kind of understanding the death and dying process of patients, which I think is really important for cancer care. And then on the left here, this was when I attended the UCONS conference. So for anyone that doesn't know what UCONS is, I put the logo on the bottom right there. It's the UK Oncology Nursing Society. It's free to join. Would recommend anyone who wants to work in cancer or does work in cancer to join it. They have excellent forums, discussion groups. They pose questions. If you've got a question about cancer care, or maybe you want to make a service improvement in your area, you can post a question which will go out to members of the society to provide answers. So, you know, if you wanted to make a change in terms of the way chemotherapy was administered in your area, you can ask colleagues what they're doing at other trusts. And so it really just links in cancer nurses all over the UK, and would strongly recommend anyone, like I said, to join that. And then on the bottom left, like I said, so we went to the UCONS conference. So once a year they do a conference. It's at different points in the UK. This year it's going to be held in Wales in November, I think. We did a poster presentation. So we talked about EMDTs for patients. So instead of getting everyone in the room doing that electronically, kind of presented data on that with some of my colleagues from HCA. And it's also a great networking opportunity. There's lots of stalls there from different organisations, from people working in cancer. So for example, the scalp cooling team, Paxman, are there. So it's great to meet those people that are providing our cold caps for patients who don't want to lose their hair during chemotherapy. And then there's loads of lectures about updates in cancer care, what other places are doing, service developments in other areas in the UK. So it's a really, really great learning opportunity for anyone. Would strongly recommend going. And it's kind of a 3-day event, so there's loads of different things that can go on. In terms of kind of recommended courses and training, so in the middle there is the UCONS SACT passport. So this is generally what's used now for anyone who wants to administer chemotherapy within the UK. It's a work that you complete. So the first part is kind of theory, and the second part is skills and kind of sign off in your clinical area. So anyone who's looking at working in an area where they want to give anti-cancer therapies will need to have this workbook now. And it's a great thing because it means kind of wherever you go in the UK, you can take this, and it's a standardized approach to giving chemotherapy, so that we all know that we're caring for our patients in the same way. And it makes it easier for the nurse if they want to move across different trusts as well. You don't necessarily need to do a different course at every trust, or local sign off at every trust you go to. So coupled with that is normally a kind of SACT systemic anti-cancer therapy course. So it will be some kind of theory learning to make sure that you have the knowledge to complete the workbook. Like I said, I did mine at King's, but there are several available across the country. The Royal Marsden School do one, and Guy's Cancer Academy as well do one. A Cancer Foundations course. So for anyone wanting to pursue a career in cancer, a Cancer Foundations course will give you kind of all the knowledge that you need as a baseline. Talks about diagnosis right through to treatment, end of life care, all sorts of things. So again, would really recommend anyone doing a Cancer Foundations course if they're looking to pursue a career in cancer, or wanting to study a bit more in relation to cancer. There are loads of disease specific courses as well. So again, if you're looking at wanting to specialize in a specific tumor type, would always recommend people doing a disease specific course, so maybe something in breast cancer or gynecological cancer, colon cancer, GI cancers, anything like that. Again, the Marsden have great ones. Macmillan also do some really good short courses for specific cancers. So again, look at them. They're often free at the point of use as well. So I'd really recommend looking at those. The other thing that we often have at HCA, which again, I know goes on at a lot of other trusts, is pharmaceutical education sessions. So where a lot of these new drugs are being brought to market, the pharmaceutical reps will often come and do teaching with us to talk us through, the outcomes of studies they've done, different types of side effects to experience with the treatment, and kind of really gives you a good opportunity to ask questions to the pharmaceutical company directly. So these are people that obviously done all the trials, have got all the data and can tell you exactly how the drugs will affect patients. And that doesn't just have to be for chemotherapy either. That could be for any new drug that is being launched. Leadership skills. So Future Learn, for example, do a great leadership module. I'm doing mine obviously through Bayes Business School, but leadership skills, if you want to work as a nurse leader, doing some kind of leadership course will stand you in really good stead. And then conferences is a key one. So UConns obviously do a great conference. The Cancer Care Conference is about to happen at the ExCeL. There's things like ESMO, which happens abroad normally. So the European Society for Medical Oncology, you can go and join that. So conferences again are a great way to network and meet people who are working within cancer care. Find out what different people are doing, and if you're looking to pursue different opportunities, it's a great chance to meet people ahead of potentially applying for a job. In terms of kind of rewards for cancer care, they are huge. So it's obviously a very challenging area to work in, but I would say one of the main things is kind of contributing to the understanding and treatment of cancer. Like I said, it's a chronic disease now. It's not it's not a death sentence for patients. So it's great to be able to contribute to kind of improving knowledge for patients, but also being on the forefront of treating a disease and actually improving quality of life or improving outcomes for patients. Like I said, triple negative breast cancer, there's been huge advances in. So it's great to be able to contribute to that and see those improvements. It's much different to how it was even 5 years ago. Multidisciplinary team working. So cancer patients often have really, really complex needs, and it gives you a really, really good opportunity to link in with, not just doctors and nurses, but allied health professionals as well, physios, complementary therapists, pharmacists. We work so closely with the pharmacy team in my area. And they are really vital to the development of our unit and treating patients. So if you want to work as a really close-knit team, rather than kind of an isolated nurse or just as part of a nursing team, cancer is really a good opportunity for that. It's a really dynamic field of medicine. So again, it's developing, it's changing all the time. If you want to be constantly learning, constantly developing, there's not one way of doing things. And actually, again, it's a real good opportunity to provide that holistic approach to patients. We also get to kind of treat them based on them, not just treat their disease. So it's really fantastic to be able to do that. And then I think the other opportunity is because there is so much development of cancer treatment, you get multiple opportunities to work with particularly consultants that are world leaders in their field. We have some fantastic consultants at LOC who are really leading the way for cancer research and really pushing the boundaries of what can be done. So it's really exciting to be able to hear what they're doing and work alongside them. They regularly come and present to us and tell them about the research or updates that they're doing to kind of improve cancer care. And then the other thing is you get the management of both the acute and the chronic side of the disease. So yes, you're treating a patient over a course of six months, maybe longer, 12 months, years potentially, but you also get patients coming in who are very sick and need very, very quick support. Inpatients, obviously you get patients coming in and being admitted, and you need to treat them and hopefully get them better so that they can go home. Our patients will often bring patients to us, first of all, if they call up and they don't feel well, so that we can manage their symptoms. There's AOS services, so acute oncology services, and a lot of NHS trusts where patients will come in not well. Acute oncology nurse specialist roles who will often go and support nurses, doctors, maybe where there isn't a cancer department in a smaller trust potentially as well. So there's really great opportunities to kind of, if you want that emergency side of care as well, you do get that with cancer. And then a huge number of career development opportunities, which I'll talk about a little bit more shortly, but there's so many different pathways with cancer care that you can follow. And then I think one of the main rewards, like I kind of said earlier, for me, is that you get to build relationships with patients and their families. COVID-19 presented a really unique opportunity where patients weren't allowed to bring relatives with them for treatment. So we had this really kind of intense get to know you period where we potentially were the only support they were getting, because their families weren't as involved in their care as they once had been. So it's really valuable to be able to provide that support to them, and where you get to do that over several months or several years. I've got patients that I know I've known since I started oncology 6 years ago. So it's really lovely to know, that you've contributed to that. I've seen their children get into university, leave university, get their first jobs, and get to kind of be a part of that and that celebration for them. So it's really great in that respect as well. Some of the challenges, so some of these are personal and some of these are kind of a bit more general. So transitioning specialties. So for me, I went from, like I said, district nursing into oncology. I did interview at one trust in London, and they felt like I interviewed well, but they thought the transition would be too hard for me going from district nursing into a completely different area. So I wasn't successful. I think if you put your mind to something, it's really easy to overcome. Take any opportunity given to you, take training opportunities, be really open and receptive to learning from other people. And particularly in my area now, there are people who have worked there far longer than I have, and I know that they have a wealth of knowledge that I probably just will never get. So, you can really learn so much from other people if you do want to transition along into a different specialty. Study alongside work, so that's been a huge challenge for me, particularly the last 2 years doing a master's alongside a full-time job. Carve out your time, liaise with your managers, ensure that you're getting kind of the support that you need to be able to do that work. Again, I regularly get people to work check for me as well. You've got people who have done, a lot of courses, a lot of study. A lot of my team are going through the chemotherapy course, for example, at the moment, and they are in an area where they can get so much support with that. So although it's challenging, you can draw support from multiple sources if you need it. COVID-19, I think that was a challenge that everyone in healthcare faced. We were really lucky in private healthcare, I think, potentially compared to the NHS. We didn't stop a lot of treatment for patients like happened in the NHS. Some of our patients opted to stop treatment because they were quite fearful of COVID-19, but most of them carried on, and we pretty much kept normal business as much as possible throughout the pandemic. The kind of main thing was changing our procedures. So we did stop visitors coming in, which was, really scary for patients, particularly those who were newly diagnosed. Coming to treatment by themselves was terrifying. It's had a massive impact as well. We lost a lot of staff during COVID-19 that just decided that, particularly our international members of staff, they wanted to go back home because travel had become so difficult. I think we had sort of 6 people leave at one point because they wanted to go back to home country, which is completely understandable, not being able to travel back and forth easily. So yeah, that was definitely a challenge, and I think continues to be a challenge in a lot of areas. And I'm sure there'll be some interesting research for that comes about how people were affected during COVID-19 in terms of staffing. Recruitment, an ongoing challenge all the time. So I think with oncology nursing, it's a really highly specialised nursing group. In London in particular, there's a lot of cancer hospitals, cancer facilities. You can, apply for multiple jobs, there's multiple opportunities, and getting people into post is not always easy, and getting really high quality staff into post is not always easy. But it does mean that if you're applying for a job, there's often a lot of great opportunities out there for you to try and get. So do look around, because you'll probably find that there's, several different things that you could potentially try. Private healthcare and the NHS, so the two, we have two systems in the UK. They don't always work the best alongside each other. And I think it's sometimes really difficult as a nurse in private healthcare, realising that we are in quite a privileged position, that our patients, were they having treatment in the NHS, there are drugs they potentially might not have access to, they might run out of treatment options, and there are sometimes delays in their care that are unavoidable. So that can be quite upsetting. Again, I see a lot for colleagues in the NHS at the moment and what they're going through in terms of pay disputes and things like that, and that's very different in the private healthcare setting. But no, it's a great opportunity for patients who can have access to private healthcare. But yeah, it is definitely a challenge, and it's something that the two systems don't always work well together. I kind of mentioned before that, it's really exciting being in such a dynamic field, but it does mean that it's quite hard working in oncology, because it is changing and developing so much all the time. Patients are often experts in their field. They come in and they sometimes have read, lots of different studies that maybe aren't applicable, or maybe they want to try. It can be quite difficult sometimes to keep up with all of that information. And that's why kind of some of the education pieces, getting teaching from pharmacy companies or from different consultants, engaging with the rest of your team is so important, because it can be difficult to keep up with a really fast growing area. Imposter syndrome, so I put this in here because it's one that I struggle with. It is sometimes really difficult, and I'm sure a lot of people have faced this, where you don't feel like you're good enough to do the job. And I think that's often sometimes where you've got people who are excellent working alongside you, and you often seek out the negatives, or maybe someone's telling you you're doing a good job and you don't believe it. And it's something that I've definitely struggled with throughout my career. I guess in terms of this, actively ask for feedback. Do ask your managers to provide you with feedback. Always reflect on the positives first, because we tend to draw to the negatives. But I think also see the negatives as constructive. There's so much to learn from feedback that you're given, both positive and negative, as to how you could do things differently, do things better. And then I think if you're looking at doing a leadership role, or maybe you're working in a leadership role, it's so important to boost the self-esteem of your team. I think we're so quick sometimes to tell people what they could be doing better or how we need to improve. And actually, we sometimes just forget to tell people that they are doing a really good job and they've made a really big difference. And that's one of the key things I've tried to work on over the last 12 months in particular, is just, we work in a really difficult field. It's so important to remind people that they provide excellent care. And then the final one I put was knowing your plan or goal. And I think it's okay to not know what you want to do. A lot of the time people will ask me, what are you going to be doing in 5 years? And I have no idea, and that's fine. It's great to work in a field where there is so much diversity. You could move to anything, but it's okay to not know what the next step is. Yeah, and just kind of, I would reflect on, what you've learned. And the biggest thing I think is take any opportunity you're given. I will always go to any meeting if someone says, can you step into this for me? Or, if there's some teaching going on, I'll always do my best to try and get there, because it's just exposure to what else is going on in cancer, and, has provided me with some insight into things that maybe I would want to do in the future, or I want to know more about. But it's okay to not know that as well. This is just a little bit around HCA. So we have more facilities than this, but these are the ones that do cancer care at HCA. So if anybody, was thinking about transition to private healthcare, there is a huge number of facilities across the organisation in which you can work in cancer care, across London, and the Christie is in Manchester. Sarah Cannon is our research institute. So if anybody was looking to do research, that takes place there. So there's a huge opportunity within HCA. And I think the other thing is that does mean that you can easily move within the organisation. For me, I've worked at 3 different facilities within the organisation now, and it's been great for me to just develop and work alongside lots of different people. And I know that's the same for a lot of trusts elsewhere. There's lots of different departments and roles that you can look at, sister trusts, that type of thing. So do try and find out what's going on and what other roles there are in other areas that you can visit, because there's lots that you can learn from other people working across your company, not just in your area. In terms of career pathways, so there is so much with oncology, and I probably haven't exhausted them all here. Clinically, there's loads of different areas that you can work in. You can work in medical, hematology, surgery, palliative care, radiotherapy, and that's kind of not even covering everything. Acute oncology is a kind of huge area that's developed a lot. So again, providing a bit more kind of emergency care to patients, and often those specialist roles are in trusts that don't maybe have cancer wards available. UCon's triage. So like I said, I manage our triage service. It's a great skill to have if you can ever do training. It will really help your assessment skills of patients, not just for chemotherapy, not just if they're calling on well, but your general nursing assessment skills. Clinical research, like I mentioned, clinical nurse specialists, prescribing. A lot of nurses do prescribing now, and non-medical prescribing, and that means that you can sometimes prescribe some of the cancer medications or supportive medications. And then advanced nurse practitioners as well is a huge role that's developing in the NHS, and kind of moving towards nurse consultancy and things like that. So it's a great opportunity for anyone that really wants to be at the top of the field in terms of what you can do clinically. Leadership, there's loads of different roles available. Again, matron, sister, right up to lead cancer nurses, chief nurses. Gives you an opportunity to do line management of individuals. Link roles, so if you maybe a link for tissue viability, for example, you get to kind of drive quality improvement in your area, drive service change, and it's a great thing. Anyone who is looking for the next step in leadership, a link role is a great thing to be able to say you've done. When I interview people, if someone says I've done this link role, this is how I improve my unit, it's a really great thing that as a junior nurse you can do. And then quality improvement, clinical governance. So how does the service work? How can the service be better? Looking at feedback. Again, really great, particularly if you ever want to be involved in things like CQC inspections. Really, really great exposures to get to those things. And then education. So clinical practice facilitators, potentially working with new students, new members of staff, looking at, delivering a new improvement in or something that you're doing on the unit. Mentorship, and that could be from students right through to new starters to colleagues, and you constantly are mentoring anyone you work with. They don't have to be new. SACT assessors, so if you wanted to be a sign-off for someone administering chemotherapy in your area, there's courses that you can do to become an assessor. Course teaching and lecturing, and that could be at university, that could be locally. Developing national guidance, so again for cancer, there's cancer strategy. People are always being looked to contribute to that. Preceptorship, again supporting newer people, newly qualified nurses. Pharmaceutical companies, there's loads of roles in cancer care if you wanted to work with a pharmaceutical company, again delivering education on drugs. Clinical supervision, so that's something that's so important, particularly in cancer care, and it's not a how can we do better, it's just understanding our reaction to things. A lot of the time we work with a really difficult disease in cancer care, and I think clinical supervision is so important, and being able to facilitate that is fantastic. And then patient information, so developing information for patients for anything. It could be it could be chemotherapy, immunotherapy, it could be how to talk to their children about how they've got cancer, for example. But there's so much education you can do with patients in terms of that as well. This is just a little graphic to kind of represent one of the best pieces of advice I was given, and I think it kind of represents that your career journey and your career pathway is like climbing a rock, I guess. And rock climbing isn't always linear. It's not always a straight line up to the top of your career. Often you have to take sideways steps or take downward steps to get to your goal, and that's okay. And I think sometimes people, if you do take a step down in your career, people think why have you taken a step down? But to get to where you want to be, it's sometimes really important in order to be able to consolidate learning and your knowledge and skills. So it's okay to take a step down or take a step sideways in order to get to where you want to be. Just some interview tips generally. So again, I've done a lot of interviews of oncology nurses over the years, so I thought some of this might be helpful to those of you potentially wanting a career in oncology. Questions. So we love getting questions. We love talking through, and obviously I'm excited to answer some of your questions at the end of this. You know, asking questions shows your interest in the role. I think for you as well, it's your opportunity to interview your interviewer. If you want to know more about the area, do ask questions. Ask about, you know, development opportunities, career progression, how the teams are looked after. You know, it's a great opportunity for you to find out if this is somewhere you would want to work. Prepare, obviously, you know, it does show an interview when people haven't prepared properly. Think about your past experiences. Questions are often scenario based. Think about what you would do. You know, be ready to sell yourself based on the experiences that you've had, and those don't always have to be cancer related. Nursing gives you a huge amount of transferable skills across specialties. So think about how something you've done could be applied elsewhere. Awareness, and so this is kind of, it's okay to say that you have a knowledge gap. You know, acknowledging that is really brave, and it's fine to say I actually don't know, I've not come across that. But think about how you would overcome something or overcome a barrier. If you weren't sure, would you escalate? Where would you look for advice? Where would you look for support? Be prepared to say that. Research. So I love it when people come in and they've done research about the organisation or the role. Talk to your interviewer about why you want to work where you're applying over somewhere else. A great thing, and something that I always do before I go for an interview, is read a CQC report. So it's, you know, the most recent hospital inspection. It can help you identify what's really great about the trust or areas for improvement, and give you some information about that. Passion. So show you're passionate about the role you're applying for. Try not to be nervous. I know that's so difficult in an interview, not to be nervous, but really try and show why you are passionate and why you want to work in that role. And then the thing I would really recommend, and this was something that one of my colleagues said to me, is go for a walk around ahead of the interview. You know, my colleague once said to me that she would never take a job somewhere she hadn't been to, because she wouldn't want to work somewhere that she'd never seen. Units will always be happy to show you around, and it's a great opportunity to meet a potential manager, meet teams, and see where you would be working. So I'd really encourage people to go for a walk around ahead of interview, because you want to make sure the job fits you as much as us, you know, making sure that you fit the job. So yeah, do go for a walk around if you get the opportunity. And this kind of just some lovely pictures of my team to finish off. What I would say is, you know, cancer's a really difficult area to work in. And what's most important is having good support networks around you. Use your team, link in with them, you know, draw support from each other, use their experience, but it's also okay to say you're not okay. And at some point in cancer nursing, you know, you will come across times where you really struggle with something, when a patient, you know, has got really sick, or you've just had a really difficult day, and surrounding yourself with a good team is the most important thing. So build those relationships with your colleagues, support each other, and, you know, you'll find that you can make a really great career in cancer nursing. And that's the end. Don't know if anybody's got any questions.
Brilliant, thank you so much. That was very, very insightful. So I think everyone can give you a virtual round of applause there. So questions coming into the chat box. First one, is it better to gain experience in oncology in one's home country and then come to the UK? Or is it possible to come to the UK and get a job immediately in oncology?
Yeah, so I think it depends what area you want to work in. So when I look at outpatients and chemotherapy administration, we often want people that have got some exposure to oncology. Again, because what we do in a chemotherapy administration setting is quite highly specialised. Getting a job in an oncology ward, you can get if you don't have experience in oncology. And actually there's loads of OSCE programs, for example, you know, where you can come over as an international nurse and be sponsored to get your registration in the UK. Often it's just showing that you've got the transferable skills, and that's, you know, often just showing that you're caring, that you can look after patients in a holistic manner, and showing, often it's skills around patient care, managing a complaint or managing conflict, sharing knowledge and skills with the team, and you don't necessarily get that in oncology, and you don't necessarily have to have that in oncology. That could be any area that you could use transferable skills. So you don't necessarily have to have experience in oncology to get a job in oncology, because everyone has to start somewhere.
Absolutely. Next question: is a SAC passport a must for working as a senior staff nurse, or is there another way to progress without it?
So again, I think it depends in the area that you want to work. In a chemotherapy outpatient setting, we would absolutely want people to have that. So for example, in my area, we've got people that are highly specialized and have done a lot of oncology work, but haven't been involved in chemotherapy administration, and we will take them as a senior staff nurse without that. But there will be an expectation that you will do that fairly quickly after joining, because it's our assurance that you have the skill to do that, and you need to show an interest and passion in that. In other areas, in an inpatient setting where that's not necessarily a key part of the role, you don't necessarily have to do it. But obviously a lot of those, I think it's not even necessarily about administering chemotherapy. A huge part of cancer nursing is having an understanding of side effects. So the course, even if you're not particularly interested in administering chemotherapy, is really important and really helpful for developing your knowledge in, managing side effects. A lot of your patients will come in with nausea, constipation, pain, neutropenia, for example. A lot of oncology patients will come in with low white blood cells, maybe sepsis, and it gives you more knowledge about how to manage that. So it's not a must, but I would say it's really helpful for anyone wanting to have a senior staff nurse role, particularly where you're going to be potentially leading a shift and telling your more junior colleagues what to do. It is probably quite valuable.
Cool. Next question. I know you touched on kind of the interview process, but what are the typical interview questions one could expect? If you could give some examples of what you could be asked.
So I'd say for things like for a senior staff nurse, we're often looking at conflict resolution. So maybe an example of a patient complaint that you've dealt with, or maybe if there was a conflict with a colleague where maybe there was a disagreement or a misunderstanding, communication issue. For a senior staff nurse, a band 6 post, we're always looking at kind of leadership skills. So how would you manage your workload? At what point would you escalate things, or how would you manage without escalating? There's often a safeguarding question, so have a really good understanding of safeguarding. And then on the kind of technical side of things, a lot of the questions are often based around oncology emergencies, so things like sepsis, maybe bowel obstruction, metastatic spinal cord compression. There's kind of 8 or 9 key oncology emergencies. So anyone, again, wanting to look at an interview in oncology, it's good to have an understanding of how those would be managed. And in an inpatient setting, that's often a lot of what you do. For a sister, it's often questions around maybe challenging a consultant. So if a consultant made a decision about care that you didn't agree with, how would you challenge that? Because that can be quite difficult to do. Again, it's that next step in leadership. So if you were the person who was something was being escalated to, how would you manage that? And things around kind of quality. So how maybe a quality improvement that you've made in your area. So, where I was talking about link nurses, for example, you can talk a lot about how you made an improvement in something in your area because you've had to drive that change as the link nurse. Yeah, those types of things.
Fantastic. This question comes up, I think, quite a lot in a lot of the presentations. How quickly can I progress from staff nurse to senior staff nurse in the UK? I guess there's no real.
Yeah. I think it's how long is a piece of string? I did it in sort of 9 months. So, but I don't know if I'm the example or if I'm outside the exception. I'm not sure. But I think it's showing you can do it very quickly if you show passion for it. And like I said, that's why I sort of would always take, when I was a staff nurse, I was really keen to lead the unit early on. And often you're doing that while there are more senior people on shift around to support you. If you want to progress quickly, have conversations with your manager about that. I love, again, when people start with me and they say, you know, I have this goal and this is what I want to be doing in a year or 2 years, because then from the start, we're looking at how we can support you to achieve that. But I think, you know, it's perfectly realistic to do that within a year.
Fantastic. Yeah, I agree with you. It's not always kind of just one size fits all, right? It's obviously depends on,
Yeah.
I guess, you being selected for interview and then obviously performing well in the interview as well, and kind of looking at those leadership elements as well, which are really important. How do you know, this is a bit of a long question, how do you know you're ready for the SAG? What is the process to getting on the course? How long does it take to complete? Does it get funded by private or NHS? So first part, how do you know you're ready for the SAG? And what is the process to get on the course?
So how do you know you're ready? I think having a good base, so if you work in oncology, having a good kind of basic understanding of cancer care is the most important thing. As a new nurse to cancer, it would probably be too much of a stretch. You need to really consolidate that oncology knowledge when you start. But again, I think probably around the 8-9 month mark is where you might be looking at it. Again, we've taken staff nurses who have had a year experience in oncology, and immediately when they join us, we put them through that course. But I think, yeah, probably 9 months to a year, and then you probably feel like you're ready. But I think the key thing is having an interest in it. So actually, if you think it's something you want to do, you'll be driven to achieve it and do it. So again, it's conversations with your manager about, you know, I think I'd like to do this. Yeah, can I? And you know, they'll guide you and say, I think, you know, maybe you need to get some more exposure in X, Y, and Z, or yes, absolutely, let's put you through that. The process for applying is you often apply either directly with the university, or, you know, we do ours through Guy's Cancer Academy. So we have kind of within in-house, we have an educational team that will support people to apply. It's often a short application that are kind of asking, you know, what are you doing at the moment? What kind of patients are you looking after and why do you want to do it? The application is quite short. And then I think the next bit was around funding. Yeah, so it is. So HCA, for example, will fund everyone we put through it. And when you've done the actual course, there is an option to go on and do kind of the level 7 qualification through King's College University, and kind of do the essay and get the kind of master's level 30 credits. Most NHS trusts will support a number of people through it as well, but it might be a smaller pool that go through it at one time, because obviously the funding is slightly different in the NHS. So
cool. And can you do it from abroad? Because some people have tuned in from overseas. Can you do SAC from abroad, or is it only offered in the UK?
Yeah, so most of the courses you can do distance learning now. So you could absolutely, I'm sure, because there's not much classroom teaching anymore since COVID. It's all kind of online, and it's often a day every couple of weeks, and then it's a lot of self-directed learning. Whether or not the UCon's passport would be relevant overseas, I don't know. And your area might want you to do a more local qualification. For example, colleagues who I've got from Australia have done kind of local courses in Australia, and whether or not the SACT passport would be relevant overseas, I'm not sure. But you can certainly do like distance learning with most of these courses, because a lot of it is self-directed learning with a few lectures thrown in here and there.
Cool. And the last question, I'll ask the last question. What is one for aspiring nurses like yourself? What is the one book or journal, something you've read that has really inspired you, and that you would recommend to all the listeners tonight?
Oh, that's a really hard question.
Should have asked you before we started.
Yeah, you should. You should have. Oh, I don't know. I think, I don't know. I've read a lot. I think the British Journal of Nursing is great. You can get the nursing journal, and along with that, if you can get a supplement in your specialist area. So for me, I get the British Journal of Nursing every so often it comes with an oncology specific supplement. So for me, that's kind of key in keeping me up to date with what's going on in oncology, and that's free alongside my Royal College of Nursing membership. So if anyone is an RCN member, do go and look at that, because you can get that for free. But yeah, journals are great. UCons as well, I would say. Like I said at the start, anyone, please, if you want to do cancer nursing in the UK, do sign up to be a member of the UK Oncology Nursing Society, because there is so much put out by that group in terms of free, and so much of it is free courses that you can do that will really help you. That would probably be the biggest takeaway I'd say, is please go and join UCons.
Great, fantastic. Well, we're at 8 o'clock. It's been an hour. That was really insightful. Thank you so much, everyone. Please give Megan a big round of applause. Like I said, this has been recorded and it will go up on YouTube, so you can share with your friends and your colleagues from around the world. But yeah, we'll be switching off now. So thank you so much, everyone, for joining. And if you do have any questions, feel free to email hello@medimatch.io. And Megan, if you don't mind, we can also provide your email. And I know Jimmy's joined as well from HCA. So if you don't mind, I can also provide your email addresses to everyone that's joined tonight.
Yeah, absolutely.
Cool. Thank you so much, and take care and have a good evening.
Thanks so much.
All the best. Bye-bye.